So welcome everyone to our seventh meeting of our 2021 virtual meeting series. And thank you for attending. And this time we have Dr. Rob Hopkins again, and he's talking about, we originally titled the presentation Lower Extremity Edema, and he's expanded that a little bit to lymphedema because he has other things to tell us about it. So we'll do what we usually do is I'm going to talk about my co-host for a second. Dawn is going to formally introduce Dr. Hopkins. Dr. Hopkins, thank you for being here and doing this for us. And then followed by Dr. Hopkins' presentation, some Q&As, a few announcements by me, and then the prize drawing. So we'll get through all that. But to start with, if you haven't been here, and even if you, most of you know Dawn, I guess what I'm trying to say, but I'll give you a little bit about Dawn anyway, what she is up to in case you are new. So Dawn is a certified genetic counselor and the program leader at the Emory Lysosomal Storage Disease Center. And in addition to that, she is a assistant professor, clinical researcher, and a director of the Genetic Clinical Trials Center at Emory in the Department of Human Genetics. Her interests are obviously Fabry disease, and she spent many years working for people with Fabry disease and built up such a great program at Emory and does so much in so many ways. It's hard to describe everything she's involved with. Lots of research in being the author or contributor to papers. She is the co-founder of Think Genetic, another organization that's doing good things for people with diseases in general and recognition and information about them. And also, if you've noticed on our website, and you probably know from other sources, that Dawn has written several children's books. She is just our Jill of all trades, and she does everything well. And I don't know how she keeps up, but thank you again, Dawn, for being my co-host and question and answer moderator, and also the other things that you do for me and for the Fabry community. So thank you. And if you'll take it away with introduce Dr. Rob, that would be great.
Thank you, Jerry. I always appreciate your introductions. They always make me feel like a combination of, wow, do I really do all that? And a little bit embarrassed about it, but thank you. I appreciate it. And when we say a formal introduction for Dr. Rob Hopkins, I think I actually have to do more of an informal introduction because Rob Hopkins is well known in this community for not only his amazing work with Fabry disease, both clinical and research, but also his handstands when he goes over home plate at Family Fabry Camp. In his spare time, he's an associate professor at Cincinnati Children's Hospital, where he focuses on not just Fabry, but other genetic diseases as well. But I feel strongly that Fabry must be number one in the list of genetic diseases in his heart. So with that, I give you Rob Hopkins.
All right. Thank you for inviting me. This talk is a new one. I have never spoken about this as the only or as the main focus of a talk before. And I went to look it up and find papers that are on this topic and found that there are not very many of them, but we'll get to that. I will warn you that there are going to be some pictures that some people may find disturbing in this. Nothing that's inappropriate, just not particularly attractive. And we will take it from there. So, as you know, Fabry disease is an X-linked storage disease. Both men and women can be affected. Patterns of involvement differ between men and women. And it's common enough that I think it's the most common lysosomal storage disease, although a lot of speakers will still say Gaucher disease is. I think we've passed them. The incidence is not completely clear. And if you're talking classical, I think the 1 in 40,000 is pretty close for men and 1 in 20,000 for women. The non-classical Fabry disease, it really depends on how you classify certain variants. There's a huge variability. So runs in families, and as you can see on this, there are lots of different manifestations of Fabry disease. And we are going to be talking mainly about one of them. So this is a list of major complications. The one we're going to be talking about today is lymphedema, and it is, I think, extremely underemphasized. So age of symptoms for Fabry disease can start as early as 2. They increase as you go through time. This slide has lymphedema in adulthood, which is consistent with the published literature. I have had at least 2 pediatric patients who had some lymphedema related to Fabry disease. So it might start a little bit earlier than that, but they were in adolescence. So this is a picture that some of you may recognize, but hopefully it's anonymous enough. This is a foot and somebody's ankle, and you can see around the ankle there are a couple of dents in that foot. And those are fingerprints, if I'm not mistaken, although I can't be completely sure. And that is what lymphedema looks like. It is just fluid collection in the soft tissues. And some of that is in the skin. There's also swelling that's in the other tissues in that ankle. And that can occurs predominantly in the lower extremity, in other words, the leg and the foot, but it can occur in other parts of the body. So this is what we're talking about. And you may be wondering, but why is that so important? And we'll get to that. So I tried to look up how common is lymphedema in association with Fabry disease, and I did not find good published numbers. It's just not very well documented. We will talk more about that later. The other thing that most people don't realize is that this really can be life-threatening. And again, we'll talk a little bit more about that a little bit later. But this is something that needs to be taken seriously. It is both an important quality of life issue and also an important quantity of life issue. The underlying pathology is also incompletely understood. There have been research projects proposed to look at it, and a couple of small ones have been done and published, but there really isn't a good explanation for all of the details that we need for this. However, the strongest explanation that we have currently is that the storage that you get in blood vessels, a lot of that is in the endothelium, which are the cells that line the blood vessels. The lymph vessels are part of your circulatory system. Their job is to collect all of the fluid that leaks out of your blood vessels and channel it back into your circulation. And they are lined by the same kind of cells that line the blood vessels. So if the ones that line the blood vessels are filling up with GL3, there's a good chance that so are the lymphatic vessels, and that then can cause partial obstruction, which leads to narrowing, which slows down the flow and backs up the pressure, and that probably leads, at least contributes to lymphedema. So lymphedema was the first paper and one of very few that focused on lymphedema in Fabry disease, was published in 1979. And it was a 49-year-old man who reported that his two brothers also had the same thing, but the two brothers were deceased when he was evaluated. And he was seen by his physician and had chronic lymphedema, meaning swelling in his legs up past the knees. And he also, when they checked him out, had high blood pressure, advanced kidney disease with renal insufficiency, and heart failure. He was recognized as having Fabry disease, and at that time, as you probably realize if you look at the date on this, there was no treatment for Fabry disease. So they said, wow, that looks really interesting. I wonder if you have two things or one thing in your family. A year later, the same group, they changed the order of the authors, so it wasn't the same paper, had published at least one additional family. I was not able to get that paper, and it was written in Italian, so I wouldn't have been able to read it anyway. But they had a second paper that also reported a family, or that one had two families, but I think it was a rehash of the first family and an added family with 4 more people who had lymphedema and Fabry disease. There were several additional single families or single cases reported up until 2003, and that was it. And there was still a lot of debate about whether Fabry disease was causing the lymphedema or not. And then in 2003, somebody did a study where they recruited 5 males with Fabry disease and 5 females and evaluated their lymphatics in their feet and legs. And they did that with a what they described as a mildly invasive procedure. And 3 of the people had significant chronic lymphedema, and the other ones did not. The 3 men with lymphedema, when they injected some dye into the swollen tissue, instead of staying right around the injection site, the dye flowed out into the tissue and covered about 10 times as much area as that same dose of dye would in a patient who did not have Fabry disease. And that wasn't a big surprise because we knew that there was a lot of fluid in there. At least I don't think it was a big surprise. I was not part of the paper, but the 5 females and 2 other males that did not have lymphedema had about 3 times the spread of the dye that was seen in the control population. They also took some biopsies of the tissue around where the swelling is expected to take place from both those with lymphedema and those without lymphedema, and they found what they described as fragmentation of microlymphatic vessels, which meant you had areas of narrowing and areas that were dilated. So I'm thinking like the long balloons that they use to make animals, and then when they twist them to like make a new part of the wiener dog or whatever animal you're making, that is an area of narrowing, and then that makes the rest of it get just a little bit fatter. And I think it's something kind of like that, only it's a much more complex thing in your legs. And that is really important because they found that fragmentation and dilation of microlymphatics in all of the patients, all 10, males and females, with or without symptomatic lymphedema. And they measured the fluid pressure in the legs, and those with the significant lymphedema had increased pressure, which complicates the problem because it backs up pressure into the blood system, which causes more fluid to leak out of the blood vessels, which aggravates the fluid accumulation in that part of your body. So that one is actually quite important. And again, they did some actual experiments and measured some things and found that it's a very small study, but it is an important and apparently very common complication of Fabry disease. So then the next publication, there were a total of 17 publications that mentioned the word Fabry and had the word lymphedema in them. 3 of those had nothing to do with lymphedema, and 2 of them had nothing to do with Fabry disease, but somebody with the name Fabry was mentioned. But in any case, this one, chapter 24, has 4 paragraphs on lymphedema, and it's a review. One of the things that I found quite interesting was that Dr. Anderson of Anderson Fabry disease, so he described one of the first 2 cases in a family that actually is still being followed in the area where he worked with Fabry disease. And he described lymphedema in his patient. The chapter 24 recommended compression stockings in people who have lymphedema. So Fabry disease and the skin is another paper, and this one actually does have some information on the frequency of reported lymphedema from the FOS registry. And they reported that in their registry in 2007, 25% of adult males and 17% of females reported some issues with lymphedema. And that's a pretty common amount, but I think it's an underestimate. Then they reported as a second thing, as a subset of that population, irreversible lymphedema in 16% of the males and 6% of the females. The average age that these reports were made was 37 in the men and 47 in the women. And that is pretty early in life and to have serious complications. So we've looked twice in Cincinnati, and I could not find the most recent one, so I'm quoting the first time we looked at our population. For lymphedema, we found 40% of the patients had some lymphedema, and that was, I think we looked at the total population of people with Fabry disease was 64 for this particular thing. 4 of those 64 had very severe lymphedema to the point that it was incapacitating. 63% of those with lymphedema had been treated with diuretics. And we will talk a little bit more about that in a few minutes, but that's probably not the best treatment. None of those 63% that were treated with diuretics showed improvement of the lymphedema related to the diuretics. 29% of the patients with lymphedema had a complication related to treatment from diuretics, meaning they had a significant electrolyte imbalance or other issue related with the medicines that were being used to try to reduce the fluid. So I think that is an important thing, and we'll talk about why in a little bit. Okay, this is another case report, and you can see the pictures on here. The swelling goes up almost to the knees on this person's legs. Both legs are involved, one more than the other. And so this group then, after this patient presented to them, they gathered data on as many Fabry patients as they could, and they reported that 83% of patients with Fabry disease and lymphedema have lymphedema in their feet and legs. But not everybody had it there. 17% have it in their arms and hands only. Now, they did not say how many had it in both in this paper. And they found that there was decreased protein in some of the patients and implied that that was due to proteinuria. I don't think that that's actually the key driver of lymphedema in Fabry disease, because most of my patients with lymphedema have not had proteinuria or renal insufficiency. And only we have had a couple of patients who had heart failure, that the congestive heart failure, and that did aggravate the lymphedema, but most of those, I think all of them, had lymphedema before they had heart failure. So the kidney disease and the heart disease are probably not the key drivers of the lymphedema. This is what the hand edema looks like. And it's about the same as in the feet, but it's usually not as severe. But a lot of people will report to me that their hands feel puffy and sometimes are stiff. And that's maybe because they have the same kind of basic underlying pathology in their hands that drives the lymphedema in the feet. Now, I did find another paper that I did not pull any data from it, but there was a group of ophthalmologists that noted that people with Fabry disease have a little bit of extra soft tissue around their eyes. So they biopsied eyelids and found that the majority of patients that they included in their study had edema of their eyelids, and it was lymphedema as well. So this is a process that's going on in multiple parts of the body. You probably notice it mostly in places that are sort of at the end of the circulatory system. And it's most obvious in the feet because gravity helps to keep the fluid there, and then less obvious but present in the face, particularly the eyelids, and in the hands. Okay. So then another group looked at a population. This is a fairly small study, but 40 patients is not bad for a Fabry disease study. And they looked at musculoskeletal manifestations. And most of this paper talks about low bone density, pain, things like that. You can see those things on this. This is only part of the table, but severe infectious complications. And what they mean by that is that they had partial amputations because they could not clear their infections that they got in their feet related to the lymphedema. That process is the thing that makes this life-threatening, at least the main thing. And so this is lymphedema. On the left side of this slide, you see mild lymphedema. In fact, looking at those feet, I can't even be sure that there is edema, but if you were to put pressure on top of the foot or on the ankle and press for 10 seconds, it did leave a little bit of a dent when I did that. And so that is mild, but some lymphedema. Then the next one over is a little bit more, still fairly mild, but you can see that you're losing the definition in the ankle, and that you can't see the blood vessels or bones in the foot because there's swelling in the soft tissue. And then the other patient that you can see the feet from, you can see that there are dents in there, and those are from my thumbprints trying to figure out how high up the leg that went. I did have permission to use these pictures. Okay, now this is what I really want to avoid. So the one on the left, you can see somebody, this was a gentleman who wore shoes, and he took his shoes off to take the picture. So you can see that the swelling in the foot itself isn't that bad, but look at that leg. You can imagine that that is pretty uncomfortable. You can also see that the leg swelling is so severe that you're losing the hair on the leg, the color of the skin is changing. And I don't know if you guys can appreciate it, but the texture of the surface of the skin is also changing. That is a setup for some significant problems. One, the pressure in there means if you bump something, you're likely to tear the skin a little bit, and then fluid will ooze out. The other thing that will happen if you get a cut is bacteria will get in. That fluid has a lot of protein in it. It's very nutrient rich. And because the circulation isn't very good in that stretched out tissue, the defenses of your body can't, like the cells that would normally eliminate bacteria or other infections, can't get in there very well. So if an infection gets started, it grows like crazy. The other one that you see on the right side is you can see more advanced skin changes, and then you have the bandage around that. Now that could be a wrap that's trying to compress the leg, and that is part of what that is. But in that case, there is also an open wound that has been open for several weeks because the healing process doesn't work very well with this stretched, distended tissue. This is where it becomes very dangerous. The other thing that happens with this degree of lymphedema is that you carry a huge amount of weight around with you in that fluid. And in the long term, this is how that can end up. And this is actually looking better for this person. These are both the same person. There's two different views of his legs. But that is after, I think, about 3 months of aggressive treatment to try to remove as much of the fluid as possible, because he had chronic infections that had been treated with antibiotics for months and no improvement had been made. And so we sent him to a lymphedema clinic where he got lymphatic massage and then tight wraps, and also he was sent home with a lymph pump in which he would put his feet and it would squeeze his feet to try to push the fluid out of that tissue. And you can see the scarring on his legs. You can see the permanent deformation of the feet, and that there are still some open sores, but all of the area that is scarred was at one point open sores. That really scares me when I see that. And I will tell you, I have lost at least one patient specifically due to complications relating to lymphedema, bumped his foot, got an infection, unable to treat the infection, and that eventually took his life. I hate it when that happens. So this is not something to just laugh about or to ignore, something to think about and take seriously. So lymphedema starts in most cases before there is severe heart disease or renal failure, and unless there is a fluid overload related to either kidney failure or heart failure, diuretics are unlikely to be helpful. And they do, as I mentioned before, they do have risks. They can lead to electrolyte imbalances, which can complicate the kidney disease and the heart disease and make the lymphedema worse. So what do? One, you admit that you have swelling and that is something that needs attention. And then you talk to your local physician and get treatment for that. Some of the treatment options are compression stockings. Now, they aren't very comfortable, but I will say that the number of varieties that are available has improved dramatically. It used to be you could have any color you wanted as long as it was black, and they all looked the same, and it wasn't a style that complemented anyone. Now there are a few options, and there are over-the-counter ones and prescription fitted stockings. If you get to the level of this, you're going to need the custom fitted ones. We want you to start treatment when you're at this level and wear stockings that keep enough pressure on your legs that they can't swell, and wear them up high enough that there's not this kind of swelling above the level that your compression is taking place. Most of the time when I can convince people to try that, they stay stable. The lymphedema does not progress. And they report that their shoes fit better, and while they aren't completely comfortable, they're more comfortable than the swollen feet would be. If the compression stockings are not controlling, the next level up is wraps, and those usually you can be taught to do that on yourself, but you usually need to go to a lymphedema clinic for that. And there is a lymphedema clinic in almost any city that has a big hospital, because you get lymphedema from the surgeries that are done to remove cancers, or if there's an orthopedic surgeon that does hip replacements, there are going to be people who have lymphedema as a result of those kinds of procedures in most cities. I will, however, tell you, if you go to the lymphedema clinic, most of the people in it will be women who have been treated for breast cancer and have swelling in their arms. For that, it's just a very common cause of lymphedema. So be nice to the women in the clinic, and they will probably be nice to you. At least that's what my patients tell me. If the wraps are also not adequately controlling the swelling, then the lymphatic massage, and basically you get a person who's trained in it, who knows how much pressure to put on, and they just squeeze the fluid out of the tissue in your legs or in the part of your body that needs the attention. And then often as they do that, once they get the tissue down to the level of compression that they want, then they will put wraps on and be able to maintain that. And then finally, if in the most severe cases, sometimes surgery can be helpful. Now that is, I've already told you that getting a cut in your skin when you have that kind of massive swelling is quite dangerous. So that you can imagine that the surgery has potential complications and needs to be done only in expert hands. It is kind of a last-ditch thing, but it has helped some of my patients, and I think is worth considering when it's needed. So complications of lymphedema, the first one is pain. Now, people with Fabry disease have enough pain already. They don't need anything that adds to that. But swelling in your feet often aggravates the pain, the burning pain that you get in your feet. Same thing with your hands. So paying attention to that, and even if you don't have pitting edema, if your feet feel like they're swollen and you have the opportunity to, laying down for a few minutes with your feet propped up above your heart will help the fluid to drain back into your circulatory system and relieve, on a temporary basis, some of that. If you're having to do that on a regular basis, then you need to start thinking about the compression. The other thing that lymphedema does is it increases fatigue. Now, the person that I showed the very deformed feet and the legs with all the scars on, when he did that process and got his legs down to the size that that photograph was in, which was still with some significant edema, he had lost 80 pounds in fluid from that process. You do not need to carry 80 extra pounds around with you, or even 5, because you're going to be tired anyway. So pay attention to this and take care of it, because it will make a difference in how you feel. As the disease progresses, you get skin changes with hyperpigmentation and chronic blood pooling in the skin, which can stain the skin. That leads to loss of hair on the legs and flaking of the skin, and in very severe cases, just weeping of the skin, which is the fluid leaking out even when there's not a visible opening. And that, again, is a very high risk sign that indicates something needs to be done right away. The biggest thing we worry about with this is infection. And the infections are very hard to treat. Even if the bacteria causing the infection are responsive to known antibiotics, the antibiotics don't get into these tissues very effectively. And the cells that your body uses to clean up the debris and to eliminate any surviving bacteria don't penetrate the tissues very well when you get this degree of swelling. So the described cases, I already have mentioned them. The man who died, I think, was about 50 years old. I had known him for a few years at that point. His heart was in pretty good shape. His kidneys had some renal insufficiency, but were meeting his basic needs. And we had talked to him when I first met him about needing to do something about his lymphatics, and he said that he wasn't an old lady. And then a few years later, I went to contact him, and one of his kids answered the phone and informed me that he had died shortly before that of an infection in his leg, that he had bumped his foot and got a cut that didn't look like a big deal. And the next day it was looking infected, and the infection just spread very rapidly. I think that was a preventable, and that has haunted me since. Now, at that time, I was fairly new to Fabry disease, and that was, the worst lymphedema I had seen, but I didn't have a full understanding of how severe that was. Okay. And I'll talk about a couple of other cases later. The lymphedema thing, daily care for lymphedema is essential if you get to the point of moderate to severe edema. It's also important, if you can, to maintain some degree of physical activity and a healthy lifestyle. To most effectively do that, wear the stockings. They don't look good. They're not very comfortable, but we want you to be around. And that, at least for me, is the main thing. It will also help you to get better quality of life if you do these things and really take care of it. And sometimes you really need aggressive care. The lymph pumps that squeeze your feet are also available. And I think there is a need to learn how to use them most effectively, and you probably would need to have a prescription, and usually people will rent those from a medical supply place if you need that kind of thing. And they squeeze your feet. I don't know how that feels, but I do know that my patients who have used it have said that it was worth the time that it took and the disruption of their daily activities to get their feet squeezed down to an appropriate size, and then either wrapped or put into an appropriate compression stocking and maintain that. So they would do that before going out to keep from having the added pain that goes with the increased swelling. So this is another story. This was one of the first Fabry family camps. You can see the picture there, and look at particularly the left leg. He was not able to walk any distances and was wheelchair bound. And there were a couple of people in camp for a couple of years that had that degree. And I don't remember if the one in this picture was one of the people who talked to us about the possibility of amputation or not. And that's a pretty drastic measure when you're saying my leg is so painful and so useless that I'd rather just get rid of it. So when we saw this, and we had, I don't remember for sure how many of them there were, but at least 2 people at the camp a couple of times with this massive lymphedema. And this particular guy got plugged in, got some therapies done, and this picture on the right is the same guy's legs. You will notice that both of his legs are improved, and he's standing up, not sitting in a wheelchair. His ability to be active has greatly improved. I have had several patients like that. I had another guy who came in to see me in his mid-30s and came in a wheelchair, and we worked very hard to get him plugged in and keep him plugged in for the lymphatic care that he needed. He got wraps and massage initially, and then was able to cut back to just wearing the compression stockings. The last time I saw him, which was a couple of years ago, he walked into clinic, and that was 15 years after he had been wheeled in. So a big improvement in him. He has been able to maintain his employment and his level of activity at a level that I had not anticipated at all, because he opted for more aggressive care. And I asked him about it, and he said absolutely that I should push people on this, that it was one of the best things he had done to get this
I
taken
have a
care
comment. I have a comment.
of. Okay.
This guy in the picture here, he went through the lymphedema clinic process, and then he started mall walking. So he got progressive wraps. He started mall walking, and he's walking around doing all sorts of normal things today. So, it really helped him, and he's living a much more normal life. The second individual that had I don't remember now whether it was one leg or both, but he did in fact go back and have his leg amputated. That was at camp that year, which was a shame. And he was that person that said, this is so troublesome, I'm just going to get rid of it, which is really disheartening. But we've learned from both Chris and many other people that, as you said, it is manageable. But can you go back to the very first slide that you showed? Is that difficult? My slide?
Yep, I'm going.
So Dr. Rob said, some of you might recognize this. Well, this is my leg. And I've had over time severe lymphedema from time to time. This was a few years ago. Well, my legs now look pretty normal. At one point, when I was in military training, we were running so much and so much activity that they just blew up, and they gained several inches in circumference in just a few weeks. And I ended up in the hospital with ice and elevation until they went down. They gave me compression socks to wear, and it eventually just cleared up and went away. But it was pretty significant. And the third thing, personally, I'd like to say is that I had two life-threatening bacterial infections. One, bacterial meningitis, which had to do with a strep infection that I got from my granddaughter, I believe. But the second one, bacteremia, we believe came from a crack in the skin in my feet. And it was another life-threatening bacterial infection. So a lot of this stuff is manageable, but it is dangerous. And if you are one of us that has a lot of lymphedema, you should really, take care with it. And I wear compression socks every day. It's some of us, you'll hear people say, I hate wearing compression socks, but you can get different degrees of different strengths of compression socks. So if they're just unbearable, talk to your doctor about to start out with a weaker compression sock, so to speak, until it's tolerable. But have someone help manage it. But if it just went out to the store and tried some and they were too tight and they hurt, you're probably not going to wear them. So get some help to make sure you have the right ones, and do it progressively and do it safely. And you may find some really good results from that. So thank you.
And most primary care docs can provide you with at least get you started on this. And if they think that that your swelling is more than they are ready to take on, they can help you find the local lymphedema clinic.
Right. That's all great information.
So this is something that I think is very important, and I was glad to be able to talk about it. It does affect both men and women. In my experience, it appears to be more common in the severe end of lymphedema, to be more common in the men, but I also do have at least 2 women who, when they got their lymphatic massage, were losing. One of them told me that every time she went in for her massage, she lost 30 pounds. That's a lot of fluid. That was a severe thing. And then another one, we were not able to get it on an ongoing basis, but she got some very aggressive care for a short period of time and had lost 80 pounds. So that is comparable to the severity of the men that I've cared for. And I think, as with most of Fabry disease, it can happen to anybody, but there will be a lot of variability in how severe things are, age of onset, things like that. But don't just accept that this is just going to happen. There's nothing I can do. There's a lot of things we can do. We need to learn to use the tools right. We need to keep the hope in mind, and we need to keep it as simple as we can for your individual needs. Well, hopefully the doctors in your lives will try to do that. And I think that's all I have to say.
Awesome. That was great. I think that you've highlighted some really severe issues that we have in Fabry disease that, you know, we focus so much time on kidneys and hearts and strokes and pain. And sometimes you've got to take a second to look back at what else is going on as well that's life-threatening and concerning. As people are thinking about this, I want to go ahead and give the magic word of the evening. The magic word of the evening is edema. EDEMA. If you'll put that in the comments, we can have that run through. And while you're doing your edema, think of your questions. I do have one question for you. We've seen at least one lady who does have some renal issues, but she has a lot of abdominal swelling. Have you seen much abdominal swelling in Fabry disease?
I've had a lot of people talk to me about feeling like their abdomen was swollen, and I have had a few patients develop pitting on their abdominal wall like they do in their, like some people get in their legs. Not a lot, just a few, but it's actually pretty common for people to tell me that they feel like there's swelling. And that would make sense. The people who did the eyelid study proposed that many of the soft tissues in the body would have a similar process, as did the people who did the biopsies of the skin on the lower legs. If that is true, then you probably would have some of that in the intestines and in the abdominal wall as well.
Yeah, it's really interesting. I've been spending some quality time with hereditary angioedema, and they have, you know, abdominal swelling that has a different mechanism, but you know, they describe this abdominal pain and these things, and it made me just wonder, you know, we know there's delayed stomach emptying in Fabry disease, but could there also be some edema as well?
I would be surprised if there weren't some, and I've wondered if that is one of the things that contributes to the nausea and the early satiety that we see.
Definitely interesting. We've got a question here, which is, what is your average strength of compression for daily use do you recommend? I'm guessing that's probably for the compression stockings. Do you have a strength you recommend?
I do not. I usually, we have a vascular malformations center, and I usually send the patients to them because they have much higher level of expertise and can spend the time to sit down and do the measurements and look at the condition of the skin and decide what's the best prescription.
Here's a good question. Are there compression stockings for the hands?
That is a really good question, and I do not know the answer to that one. I have not seen them. I think they probably exist because hand and arm swelling are quite common in the breast cancer world. So I would expect that they would exist, but I honestly have not looked. The man whose hands I showed in the other picture did not want, he does wear the compression stockings on his feet, but he said his hands don't hurt and it doesn't interfere with function. Doesn't seem to be getting worse. He didn't want anything else.
Stefan mentioned that there are socks and arms that he's seen in Germany, at least. And I think I've seen them for women post breast cancer as well, but they don't necessarily extend all the way down to the hands, which is interesting. How do you perform pit testing for pitting edema?
You just push your thumb and finger in, you grab like the ankle and you squeeze slowly, not pushing hard enough to make it hurt, but just squeeze slowly. And the tissue gives a little bit and you feel your hands sinking in like they would if you were molding clay. And then when you let go, it doesn't just pop right back. There's a dent, at least for a few seconds. And sometimes for several minutes, it will stay like that.
Good. Is there an explanation for one side of the body to be more affected by edema than the other?
There probably is, but I don't know it. That is a very common thing, and it might have to do with which leg is dominant, or if you've ever had an injury. So I have had several patients who have had, at some point in their life, a broken leg or they hurt their knee, had a torn ligament or something in a knee or a hip, and that is almost always the side that has the more severe lymphedema. The other thing that I have had at least 4 patients who have severe lymphedema have had hip disease and required hip replacements. And the hip that was replaced first is generally the one that's more severely involved with the lymphedema. So I think it's got to do with the traumas and damage, but I have not seen any data that document that. And I only know one person who's truly an expert in lymphedema and also knows something about Fabry disease.
All right, this is a really good question. It's a long one. My daughter, age 34, and I have non-classic Fabry. She had considerable swelling in her feet, ankles, and face in the 30th to 35th week of pregnancy. She had a kidney biopsy pre-pregnancy, which showed Fabry kidney involvement. She normally has protein in her urine, which has increased a lot during her last weeks of pregnancy. Last week, she was admitted to the hospital at week 35.5 and was diagnosed with preeclampsia and was already in labor. She had a difficult delivery. Her swelling has gone down, largely gone down. Will this experience make her more susceptible to lymphedema in the future? And would Galafold help prevent reoccurrence of swelling?
So the Galafold question, I have only wild guesses for. So I don't know. I think almost certainly that experience would increase the risk for lymphedema in the future, but I don't think that it's a given that she will develop lymphedema in the future. I would suggest paying attention to how she feels and treating the swelling, even if it's mild, that she does get, and regular daily exercise, but not to the point that it is adding to the damage or to the swelling, but walking and biking and things like that are not traumatic, and stopping if you start to notice swelling, and then using the appropriate preventative care to keep it from progressing should be helpful.
Here's a question. How long is worrisome for the dent to stay in your leg or foot upon pit testing?
So as far as worrisome, I don't think the length of time that the pit stays is the critical issue. That's really more the how big your ankles are getting. If you get so much swelling that you can't wear your shoes, by the end of the day, that's worrisome. If you have to change the size of your shoes, that's worrisome. The guy who had the scars on his legs had to quit wearing shoes and could only wear customized sandals at one point. That's way beyond what I would be comfortable with. But it's, you know, if I had to say, if it gets beyond 20 seconds and there's still a pit there, you're probably going to have increased risk for infections and poor wound healing. But that's just a guess. I don't have enough experience or expertise in that to be sure. It's pretty common for people to have, even people who don't have Fabry disease, to occasionally, on days when they are, for example, driving all day and can't move around very much, to get some pitting edema. That kind of edema that's incidental usually lasts 5 seconds or so.
Another question. My son is almost 16. He has swelling in just 1 foot ankle. Just started to wear compression socks. What provider or specialist would we start with for better understanding?
He could go to a lymphedema clinic. You could also go to physical medicine clinic. Some pediatric hospitals have vascular malformations clinics. That would be another place that would have a good understanding of that and what to do about it.
If it's the son I'm thinking about, he also may play sports. So I wonder if would there be anything in sports medicine that might be useful?
There might be. I mean, they certainly, a sports medicine person would have the capacity to look that up, and they do deal with swollen ankles and things, and as a complication of sports injuries, lymphedema is not uncommon.
Cool. That's the end of our current questions. Does anybody else have another question they want to put in? We also have some announcements from Jerry too. So, oh, here we go. My 25-year-old son has what I consider moderate swelling in his left foot. For years, geneticist does not seem to be concerned. Causes no pain. He's teaching karate now and on his feet all the time and kicking. Should he be more careful due to his swelling?
As far as being more careful, I don't know. He needs to make sure that there's no skin changes and that it gets measured so that he can tell if it's getting worse. But I would suggest that he wear the compression stockings, and if he can, that he wear them even when he's doing the karate to keep the swelling at bay as best he can. It's something that a lot of people just ignore. And most doctors will, unless it's dramatic, most doctors will not bring it up. But if you ask them for treatment, I think either they will make some suggestions to you, like go buy some compression stockings, and it may be that simple, or they will offer to make a referral to you to people who do that more than they do. But I think, as with many other topics related to rare disease, you're going to have to advocate for yourselves. I mean, I know I have been trying to get the pharmaceutical companies that are involved with Fabry disease to invest a little in lymphedema and doing some studies on that for almost 20 years, and it's just not getting a lot of attention still. I think if the community of patients speaks up and says, hey, we need this to be addressed, that we might be able to change that.
Mhm. Very true. And one final question, then we'll go to Jerry's announcements. When you say skin changes, my husband says it's his genes causing the shiny skin and hair loss. He has pitting edema in his ankles every day. Would you disagree?
The gene that's causing his Fabry disease is certainly contributing to it. So on that level, there are people who, I mean, I have certainly known people who had dry skin, and as they aged without lymphedema have lost hair. So there could be a genetic predisposition to that, but you don't get pitting edema without something being wrong. And if you have pitting edema, it doesn't matter if it's Fabry disease or not, you still need to pay attention to it, and it still needs to be treated, and you still have the increased risk for infections and for poor wound healing and other issues. Lymphedema as a process has those even when it's independent of Fabry disease.
All right, awesome. Thank you so much. That was great, and amazing job highlighting some of the key things and also empowering people to actually pay attention and force the issue a little bit with their edema. Jerry, you are on.
All right, well, thank you so much, Dr. Rob. That was great. And thanks, Dawn, for your moderating the questions. I have one more slide to show you. And let me pull that up and share my screen. One second. All right, can you see that slide?
Nope, not yet. It's
Okay,
not sharing your screen.
same. Let me try to share it once more. Got it on my desktop, so I don't know why it's not showing up.
There it is.
You see it now? Great. Okay, let me start. So this is just a few announcements that we do each meeting that we have. And the first one is an announcement about what's going on in industry. And so each company that we have information from is represented. So right at the very top, Sanofi Genzyme, it doesn't relate to the bullet. They have a couple of websites, and you can not worry about jotting things down. We publish the recording. You can go back to this slide in the recordings and look at it in detail, but I'll just briefly go over it. But Fabrazyme got full approval from the FDA. It's been on conditional approval for years, many years, and they have a full approval now, which your provider can explain to you what that means. But that's just new news. Amicus has a couple of, or their primary website for the Fabry community is listed. Chiesi, of course, did not get approved on the date that they went for FDA approval on the 27th of last month, and just more news to come on that as they figure out what they have to do to go back to the FDA table for approval. Then we have the 4 organizations that are doing gene therapy trials. They're all open for clinical trial enrollment if you're interested in any of those. And those are AvroBio, which is the only lentiviral gene therapy on the list. And then there are 3 AVV trials going on from Sangamo, 4DMT, and Freeline at the bottom. And then, of course, Idorsia, who is doing the substrate reduction therapy trial, they have finished enrollment and they're just collecting data until their date to go before the FDA for approval. So quick update on the companies. If you're interested in any of that, talk to your provider, and you can gain information from the different sites that are in different organizations. And clinical trial is important, and that's how we got where we're at today. So next slide is our job in keeping you informed is part of that same process is on our website. If you haven't seen it yet, on the top menu bar, if you scroll over to the company and clinic info tab, go down, you'll see you can go down to pharma info, clinic info, and support organization info. And if you go into the pharma info, you'll see a grid square for each of the various pharmaceutical industry companies that have information to provide. So you can go down to the read more button in each square and find out more information about resources that they provide. And if you go into the support org, you'll find the same thing about various, especially like financial support programs, various grid squares in there, our family assistance programs, some from ourselves. And then if you go into the clinic tab, you'll find a couple of clinics that have information. So you can get more information if you know where to look for it in that single spot on our website. And so that's something we put there that we just thought may be useful to all of you to find things when you want them. And let me advance a slide. You know, this happens every time. I have to restart it because it won't let me advance. Try something else here. I get a couple of slides. Oh, there we go. We still have plenty of calendars to distribute. So if you haven't gotten a calendar, a Fabry disease educational symptoms, educational calendar, just send me an email. So I haven't got mine yet. My email's all over the place. And here also, and say I haven't gotten my calendar yet. So please send me one. We'll send you one. And we've got a lot of calendars still in stock. So they're free. You don't have to pay for them. You just call out my name and I'll be there. And so the last thing is just on the registration website is now that this meeting is over, we'll post the recording and then we'll activate the next virtual meeting so that you can register for that. And I believe that is it. So we are, let me stop sharing. We are at the moment of announcing the prize winner for the $100 Amazon gift card. So Brenda, if you have a winner.
The winner is Darren. Darren has won a gift card. Congratulations, Darren.
So Darren, so we will get a, and you are in the Fabry community, right? You're a Fabry disease family member or caregiver, right? So we'll get you out a gift card electronically in the next 2 days. If I remember, it'll be tomorrow. If I forget, it'll be the next day. But so thank you all for participating. Thank you especially to Dr. Rob for educating us once more about an important topic in Fabry disease, and for Dawn and for all of your support and participating in all of the things that we do. We really appreciate you so much. Everyone, have a good night.
Bye, everybody. Thank you.
Good night, everybody.
I know.